So, who's the best cataract surgeon in Yorkshire? Well, we don't have a leaderboard with people being knocked off like on a squash ladder or a tennis ladder. We do have, thankfully in Yorkshire, really good standard ophthalmology, and we have a very high standard of cataract surgery and a lot of very good cataract surgeons. I think probably the best advice I could give people is to relate my own journey through some surgery that I had. It was elective surgery, as cataract surgery often is. I needed a shoulder stabilisation. It was fairly early on in my career, but I already knew that I was already a consultant actually. So my hands are clearly incredibly important to me. That's how I make my living. And with the shoulder surgery, there was a tiny risk that it might affect my dexterity, it might affect my ability to perform my job. And so I used my privileged access to medical professions and medical professionals, and I contacted one of my friends who'd been a registrar on the orthopaedic rotation in Yorkshire, and I asked him, I said, who would you get to do your shoulder stabilisation? There are quite a few well-renowned shoulder surgeons, and I'm sure they're very good, but who would you choose? And he'd operated with all of these surgeons and didn't hesitate, and he actually recommended a man called David Limb, L-I-M-B, which is a fantastic name for an orthopaedic surgeon. Did make me wonder about my own choice of career, actually, operating on eyeballs all the time. And he did a wonderful job, and my hands are perfect, you'll be pleased to know. So I was able to continue being, I hope, a very good cataract surgeon. Now, clearly you can't follow the same path as me. You don't know all the registrars in Yorkshire, and they are the surgeons who rotate around and operate with all the different cataract surgeons. But what I can tell you is that as one of the surgeons operating at the Optega Yorkshire Eye Hospital, I was one of 25 surgeons there. I was the surgeon who all the staff members asked to operate on. So I operated on 3 of the nurses, the facilities manager, my PA, the hospital manager's mother, a consultant colleague. And I was honoured to be asked on each of those occasions. But these are people who have a shortcut to knowing what surgeons are like in theatre, to get that additional information above what's published in the audit data. Because cataract surgery is so successful, everyone has good audit data. Everyone has low complication rates. And that's good news. It means that whoever's looking after you in Yorkshire, they're very likely to be doing an excellent job for you.